Happy Hospitalist Day. It's March 4th, and I'm coming in to share why I chose to do and practice hospital medicine. Hi, everyone. I'm Dr. Nina Loom. I am a family medicine trained hospitalist physician. That means I work only in the inpatient setting, taking care of adults 18 and over. I've been doing this since August 2015. I graduated from residency in July of 2015, and I've been practicing as a hospitalist ever since then, and I love it. So one of the most common questions I get is, one, why are you as a family medicine trained physician working as a hospitalist? And two, why did you choose this path out, instead of maybe outpatient practice? I understand where these questions are coming from, and I'm going to tell you a little bit about why I chose hospital medicine. So, as you already know, family medicine is heavy on primary care and it's heavy on outpatient medicine depending on where you're trained. So, sometime during residency, probably about my second year of residency, I realized that I actually really enjoyed acute care medicine, specifically taking care of patients when they're admitted to the hospital after the emergency department visit. And so at that point, I thought, oh my gosh, did I make the wrong choice, right? That can happen to any one of us. And then I thought, well, instead of focusing on the possibility that I may have picked the wrong specialty, maybe I should focus on what my options are within the specialty. So I started to investigate, and I realized that I could spend a lot of my third year, my PGY 3 year, doing more inpatient rotations as opposed to the traditional route of more clinic time and more subspecialty clinic time. I decided to reverse that, and I went back to the ICU during my last month of residency. Like, who does that, right? I went back for one intensive month of ICU beyond what was required of me, which I'd already completed during my PGY, I believe, 2 year. So once I realized that I had a passion for taking care of patients within the hospital setting, I went back and I equipped myself so that I'll be well prepared. And then I actually really enjoyed it. Like I enjoy taking care of patients when they are in the hospital because I have time to really sit down and go into the pathophysiology and the pathology of what's going on. I enjoy collaborating with other subspecialists, cardiologists, nephrologists, in particular pulmonologists, to where we can get down and really zoom in on what's going on with each of our patients. And then it's just so gratifying to be able to analyze the human body in such a unique way, using numbers, labs, radiology, using specimens, serum samples to be able to help somebody, overcome their illness. So I like the immediate gratification of inpatient medicine because, a patient comes in, they're real sick, or it's post-code or something acute happened, and I'm able to just focus in that moment and get them better. And then usually their discharge day, they're dramatically different from their admission day. I love that. Like that immediate, almost, it's not instantaneous, but it usually takes a couple of days, maybe some people weeks, some people months, unfortunately. But it takes a while, but then it's almost immediate, right? Compared to maybe in the clinic, it may take months and years before you see that the effect of like lifestyle takes into effect, or the effect of chronic disease management takes into effect. So I love that more quick response that I see. I also love that I can manage critical patients and still have the ability to get the help of a critical care intensivist or a specialist that has, spent extra time in working and learning about those patients. So I love that I can learn a little bit from there. I work in an open ICU, which means we do manage inpatient ICU cases, but we do rely a lot on our subspecialists also for some of the procedures and also for, things that are beyond the scope of primary care. So I enjoy those things. And then I also enjoy the work-life balance. Okay, so one of the things that I never thought about when I was a student was work-life balance. But now I'm so thankful because I love the fact that I work for 1 week and then I'm off for the next. So technically I only work half the year and I get paid like someone that works full time. So it's a win-win. I like that I get to work. It's 12-hour blocks and I can just focus. For 12 hours, I know I'm being a doctor. When I leave, I don't have a pager. Nobody's paging me. Nobody's calling me. I love that. I also love that, overall, with all that extra time that I have, I can focus on my family. I can focus on my passions. I love to help international medical graduates on their pursuit into residency training in the US because I'm an international medical graduate. And this is a title of a book that I wrote called Still MD, shameless plug. But I also love that I can travel, at least prior to the pandemic. I love that I used to be able to travel, and I've been able to do mission trips on that time, on that free time, which was probably the most gratifying thing, was to go to my home country and work. And I hope to do that more and more and more. Now, when I signed up to be a hospitalist, I had no idea that I would become a COVIDist. But in all honesty, it has been my utmost pleasure to serve others during this pandemic, because 10, 20, 30, 40 years from now, the experience that I've had and I'm still having as I help people that are going through the motions of the pandemic in an acute care setting, they're acutely ill. I believe if there's anything I've given back to humanity since the day I was born up until now, for 33 years that I've lived on this earth, it has been the last year of serving at the bedside and serving COVID patients. At first, it was terrifying. It was anxiety provoking because I was constantly afraid that I was going to get sick. But then a few months in, especially after my dad survived, I got a different sense of what was possible, and that survival was indeed possible. And then I started to have patients survive, especially, and I'm talking about people that got admitted. So I'm not talking about just having COVID and mild symptoms at home. I'm talking about taking care of severe COVID, and it's been the most, oh my God, most rewarding experience, to where I'm no longer afraid when I walk in their rooms. I have more courage. I have more resilience now to be able to care for them and for other patients. So those are just a few of the reasons why I chose hospital medicine. If you have doubts, you can send me an email or a message, and I can help you figure out if it's for you. All right, thanks for watching, and stay tuned to this page for more content.